Okay, thank you, Lisa, and thank you, for hosting this workshop to the Cancer Wellness Center. My name is Serena Jain, and I'm a board certified integrative health and well-being coach, and I'm the mindfulness specialist here at the Cancer Wellness Center. I teach mindfulness programs, lead different series on mindfulness, classes, workshops, talks. Of late, I'm providing one-to-one mindfulness sessions for the clients here at Cancer Wellness. And today I'm here to talk to you about integrative health for optimal well-being. So if any of you have the ability to put your camera on, please feel free to do so. It really helps for us to build community in that way. We are going to have a chance to share a practice towards the end of this program and have some discussion. So if you're able to and feel comfortable, please go ahead and put your camera on. That would be great. Again, my name is Serena Jain, and today I'm here to talk to you about integrative health for optimal well-being. And I have a slide deck, which I'm going to open up. So just give me a moment. Open it up. Okay. Can everybody see the slides? Can someone unmute and just say yes? Okay, thanks, Lisa. So today for our agenda, we're going to begin by learning what integrative health is. And then we're going to go into learning, well, what is health defined as according to the World Health Organization? I'm going to show you a diagram that's called the Wheel of Health, which we use as integrative health practitioners. And I did my training at Duke, which is where this document comes from, this Wheel of Health, which I use in my practice. I'm going to share with you actually one of my clients' journeys to whole person health, to integrative health. And then I'm going to talk about integrative health and cancer care, mind-body therapies, music therapy, and we will end with a belly breathing exercise. So let's go ahead and get started. So integrative health, what is integrative health? Well, integrative health, it takes a holistic approach to healthcare. It looks at all aspects of a person's life to help them achieve optimal health and well-being. And the National Center for Complementary and Integrative Health defines it as bringing conventional and complementary approaches together in a coordinated way. Integrative health also emphasizes multimodal interventions. And what that means are two or more interventions, such as traditional healthcare approaches like medication, physical rehabilitation, psychotherapy, and complementary healthcare approaches like acupuncture, yoga therapy, nutrition, massage, mindfulness, meditation, and doing all that in various combinations with an emphasis on treating the whole person rather than, for example, one organ system or just the symptoms of the disease. And so what does health actually mean? So according to the World Health Organization, health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So when I first read this definition for the first time when I was training, I was blown away because what it means to me is that being healthy doesn't simply mean that you're not sick or that you don't have an illness or chronic disease. Being healthy means we're in a whole state of complete well-being, not only physically, but also mentally and socially as well. And so integrative health takes the whole person approach. Because humans are whole beings, and there's many aspects of our lives that impact our health and well-being, including our physical environment, what we eat, our nutrition and lifestyle, how we live, our mental and emotional well-being, what we do, what gives us a sense of fulfillment and purpose, and whether we're doing those things, what physical activities and fitness we're engaged in. How is our sleep and rest? What is the quality of our sleep and rest like? And our mindful awareness. And then if we have a community or a sense of community around us. So what integrative health is it's a holistic approach to health. And that empowers people by examining all of these aspects of an individual's life, not simply just a disease. So this approach is not merely aimed at treating symptoms of an illness or disease, but it also looks at resolving the root cause of problems. And this approach, when followed with medical treatment, has been shown to be very effective. So why should we follow this approach? Because humans are not just our numbers or our conditions, we are whole people. We have a mind, a body, a spirit, and everything is interconnected in systems. And everything in our lives, as you can see, impacts our health and well-being. So I'm going to show you next what is called the Wheel of Health. And so here, this is a diagram called the Wheel of Health. And the Wheel of Health is a snapshot view of this whole person health idea. So as you look at this, you can go ahead and look in the middle there. And that is a person sitting there, it's you, and around you is your mindful awareness. So if you think about this image here, you can imagine that this is you and you're sitting here in the middle. And then surrounding you is your mindful awareness. And so what that means, mindful awareness means being fully aware of and tuned into what is happening now, right now, in this present moment. When we're living on autopilot or when we're not being mindful, we end up living in the past or worrying about a future that's unknown. And when that happens, we oftentimes miss the present moment altogether because we're busy reliving memories or worrying about a future that hasn't happened yet. Now, mindful awareness involves us returning back gently over and over to the present moment again and again with a sense of kindness and curiosity. And so to practice being mindfully aware, there are certain, therapies and things you can do to become more mindful. And we're going to talk about that a little bit later. Now, surrounding you and your mindful awareness are all of those elements that make up your life. So starting with the top, starting with your physical environment. So having a clean and healthy physical environment is important. It's helpful for you to reflect on how your physical environment can support your health and how it also impacts your health and well-being. And then next to physical environment is your nutrition and lifestyle. Our food that we eat, our nutrition, it fuels our mind and body. So proper nourishment supports our body's functions and keeps us sustained through our daily ups and downs in life and through life's challenges. So your lifestyle is the choices you make about your health based on your beliefs, your values, and attitudes. Nutrition and lifestyle choices can boost your body's natural healing potential. After that is your mental and emotional well-being, which helps to support you in adapting to the stressors of everyday life. And it also helps you to contribute to your community and realize your personal potential. After that, you'll see is down at the bottom is your sense of fulfillment and purpose. And what that means is what gives meaning to your life. This area aims to integrate your values and your strengths by reflecting and drawing insights from your internal world. So digging deep and finding out what gives you fulfillment and purpose in your life. And then next to that is your physical activity. So physical activity and fitness play a very important role in your health and well-being. When we make movement a part of our lives, it helps to keep us strong, helps to keep us flexible, we feel more balanced, and we feel happier. And then moving up from there, you come to your rest and your sleep. So rest and sleep and restorative relaxation, it helps us to balance our health. Not getting enough or good quality sleep can lead to disorders, sleep disorders and other disorders, which can lead to many, many chronic illnesses. So the right quantity and high quality sleep is essential for the body and the brain to heal, to repair, and to prepare for the next day. And also to sustain yourself through challenging times. And then surrounding all of this, all of these aspects is our community. The concept of community is external to the self. A person's community is built on those shared characteristics of the people in it. and by the strengths of the connections that you make among them. When you engage in community, it helps to make you feel like you have a place in the world. Community is interrelated and interconnected to all of these health and well-being components. And so as you look at this wheel of health, it's important to know that our lives are impacted by all of these aspects, many, many aspects here. And living a life that balances these elements will help put you on that path to optimal health and well-being. So I want to go into talking to you a little bit about one of my clients. And for privacy and confidentiality reasons, I'm going to call her Mary. So I'm going to share with you Mary's journey to whole person health, and so to integrative health and optimal well-being. So Mary came to me when she was a recently retired oncology nurse. And she came to me for making changes in her health and well-being. She was on track to a long-term diagnosis of depression and chronic heart disease due to her physical health problems. She had recently undergone open heart surgery for a valve replacement, and she had suffered a stroke. She was suffering from sleep issues, insomnia, mental fatigue from the stroke, and she had a sense of a lack of purpose. So her goal was to feel confident and strong and to release the fears she had around future health problems. She wanted to sleep better, she wanted to feel better and less depressed, and she wanted to gain a sense of purpose again. So she wanted to feel strong and confident in her body. And so she decided, as we looked at that wheel of health, what area she wanted to focus on the most was her mental and emotional well-being. That was the area that she felt was most out of balance. And so I began to support her in making sustainable health behavior changes that would positively impact her in her mental and emotional well-being to be able to restore herself to balance again. So Mary, we took a hard look at Mary's schedule. She was staying up late, not sleeping well at night, and sleeping late into the mornings. She lacked a daily routine, and she really wasn't taking good care of herself. She wasn't exercising as she once did, and she remained fearful of another stroke and heart attack and further complications from health issues. And ever since her retirement and recent passing of her mother, she was experiencing a sense of a loss of purpose. And so we began to dig deep into her reasons for why she had chosen mental and emotional well-being in her wheel of health as her goal. Mary was a successful oncology nurse for her entire career, and she became a mother at a very young age to 3 children, and one of them was a child with a very severe physical disability. So she had always been a caregiver. She had been to her mother, to her children, and a caregiver as her career. She was chronically overcommitting herself to the care of others and not taking care of her own self and her needs. Before retirement and before her health issues began, she had been strong physically and mentally, and she had been structured, she had been disciplined. She was always healthy too until her recent heart events and the stroke. And she was lacking a sense of purpose in her life. So we began to dig even deeper. And as we were digging, we were sort of excavating. It's as if you were using a shovel to just keep digging more and more and finding out what was the reasons underneath and underneath and underneath, all these symptoms. She was fearful, very, very fearful of developing further health issues, understandably, after having, this triple bypass surgery and valve replacement and the stroke. As a result, she was suffering from low self-esteem. She had a lack of self-confidence. She felt a lack of focus. She was often distracted. She had a lot of mental fatigue after the stroke. And she really wanted to connect better with her husband. She was constantly overcommitting to people, so she wanted to learn to say no. And she ultimately wanted most was to feel stronger physically and mentally. As we dug deeper into her why, She began to understand the most powerful piece to the puzzle of getting her health back on track. And because Mary realized that because she had always been a dedicated caregiver to her children, to her aging and sick mother who had recently passed, and because she had been a nurse, which is a caregiving role in her career, she'd always focused on everyone else's needs but her own. Now that she was retired, her kids were grown and settled, living their own lives, and she no longer had the responsibility of her mother. For the first time in her life, she found that she didn't have a sense of purpose. And her health had declined. And she really couldn't recognize herself without that role of caregiving, without that role of taking care of other people's needs, and without that sense of feeling stronger physically and mentally as she was once. She had always been an ambitious, strong, and smart woman in body and mind, and she always did well with a schedule, with structure, with discipline. But feeling little to no sense of purpose, plus the weight of those health issues and that mental fatigue, left her feeling depressed. She also realized that her sense of purpose had gone missing, and for the first time ever, she was going to need to prioritize herself. Having a strong sense of self in her body and her mind was what she valued and how she lived in her full potential. So that revelation, as we dug deeper, that came for her was a game changer. She quickly understood that she needed to get back in touch with herself, her own values, her own needs. And after that, our work together became clear and became mission driven for her. We had to get Mary back to living in her full potential. So we developed a plan and we put it into action. We created a schedule for Mary. And the schedule was this. She began to wake up early as 6:30 a.m. every day. We renewed her meditation and mindfulness practice. She started to learn mindfulness practices. I taught her different mindfulness practices. And she would practice immediately upon waking up in the morning. She would go straight to her meditation cushion. She would do some daily light stretching and she would meditate. And then she would do that in the mornings and the afternoons. She used her smartphone to schedule one thing per day on her calendar app, and that prevented her from overcommitting to the needs of others and overcommitting so that she was able to focus on herself. To improve her focus and become less distracted, we set up focus modes on her phone to limit her phone usage. She began walking every day, both with a friend and alone. Being alone in the woods really helped her build her confidence. She began journaling weekly, and she also started practicing golf weekly with her husband. She started going to yoga 2 to 3 times a week, and she started saying no to friends and social commitments that no longer felt fulfilling and purposeful. She resigned from a local volunteer board that was taking up too much of her time, and she engaged in more meaningful service work, volunteer work, through her local church and her local community. And she also joined a weekly meditation group through her local church community. Now, going through all of these changes together as a result of those action steps and schedule, and making those health behavior changes, she started to feel like herself again. She started to feel like she could access that inner confidence that she once knew. She felt more relaxed throughout the day. She felt a sense of an elevated mood. She was really better able to manage that stress that happens in day-to-day life. She had a higher sense of self-esteem, and she was able to focus on herself by saying no to things that weren't serving her. She had more meaningful social interactions with people, and she was no longer, doing things that she did out of obligation. She proceeded to do volunteer work that was meaningful for her, and ultimately, she felt strong in her mind and her body. So after a while, we got in touch again, and we realized that Mary was on track to her mental and emotional well-being goal. She had aligned herself with her values of confidence, strength, purpose, and health and well-being. And she did that by having a regular meditation practice. She had a regular exercise practice of walking, yoga, and golf. She was better able to manage all stressors that she encountered. And she had more meaningful commitments in her life and her social life. She released that need that she often felt to overcommit. And she no longer felt in constant fear of future heart and health problems. Ultimately, she felt stronger in mind and body. So her overall results felt very, very good to her. She realized that she was capable of making these health behavior habit changes. She felt empowered for doing so, for creating that schedule, sticking to it, and following through. She was able to stay on track by holding herself accountable to it. She was proud of herself for being able to tackle these changes. And she was also proud of herself for balancing that imbalance in her wheel of health, in her emotional and mental well-being. And she felt that she was on the pathway to living a life in optimal health and well-being. So Mary is an example of a healing journey through an integrative health and well-being approach. Through the process of uncovering a person's story, we connect them to their core values and their personal potential. We treat the whole person and we address any areas of imbalance that we find in their wheel of health. This approach, this integrative health and well-being approach, helps to resolve root causes of problems, and it works in collaboration with traditional medicine to help individuals assist in restoring their holistic health, their whole person health, and coming to live a life of more optimal health and well-being in line with their own personal vision and values. So before we move on, I just want to stop here for a moment to see if there's any questions just about this. We're going to move on into talking about integrative health and cancer care. Okay, and we'll have time for questions at the end as well. So now I want to share with you a little bit about integrative health and cancer care. Integrative health weaves natural treatments into the overall care plan when it comes to cancer care. It incorporates holistic health services and programs based on scientific evidence, on research that's been done. And there's many benefits to taking this approach in cancer care. What we found is that that patients are better able to handle the side effects from chemotherapy and radiation. They're better able to minimize that feeling of anxiety, depression, and stress that can come with the diagnosis during and post. They can understand and use herbs, vitamins, and other dietary supplement options in their treatment. Using these approaches helps them to control fatigue, neuropathy, dry mouth, hot flashes, and other symptoms. It also helps them to improve muscle strength, balance, and endurance, to reduce and cope with pain and muscle tension. And it also helps them to understand how they can tap into and experience the power of the breath. We're going to do a breath exercise a little bit later, so you'll be able to understand what we're talking about here. So some mind-body therapies that we recommend for cancer care are a group of healing techniques that enhance the mind's interactions with bodily function to give yourself a feeling of relaxation, to induce that feeling of relaxation, and to improve overall health and well-being. To do these, it's important to practice daily for deriving the benefits from these types of therapies. These types of therapies have become increasingly popular over the last 2 decades. There's a growing body of research out there that indicates that mind-body therapies are safe, they're effective, and they're great ways to mitigate physical and emotional symptoms and improve coping skills in cancer patients. Because these practices are pleasant, non-invasive, and beneficial, they are most suited for patients and survivors to help manage their own care. These therapies and practices can be done in one-to-one sessions. They can also be done in classes or workshops. And so I'll just go down the list. So there's acupuncture, aromatherapy, guided imagery, low-intensity exercise, meditation and breath work, massage therapy, qigong, tai chi, yoga, music therapy, and herbs and supplements. And so these are some of the mind-body therapies that have been researched and proven to help with the symptoms of cancer. So I want to talk to you a little bit about music therapy. Music therapy is an evidence-based way to improve your health, enhance your well-being, and manage those symptoms and side effects related to cancer and cancer treatment. So what happens during music therapy is a trained music therapist guides you through activities using unique qualities of music to achieve specific health outcomes. These activities can be simple things like listening to music or as interactive as creating music together, with the therapist. So whether you're facing health challenges or undergoing treatment or caring for someone who's undergoing treatment, music therapy can help with those symptoms such as stress, anxiety, depression, fatigue. It can help with pain, with sleep, memory, focus, learning. It can help with brain health, with coordination, creativity, mental flexibility. It can help with building your resilience and adaptability. It can help enhance your physical and mental performance. And it can help you discover a joy and a meaning in life. And it can also help you strengthen connections with loved ones. So why should you do it? Well, it's very safe and effective. It's recommended in cancer care and supported by numerous scientific studies as a non-invasive treatment with minimal side effects. It's a great non-drug option, and it's a great for people who are already on a lot of medications and are concerned about taking more medications. It's for everyone, really. It's beneficial for all of individuals, all ages. No musical background is needed to experience the benefits of musical therapy sessions. You can find personalized treatment. So each music therapy session is tailored to your own unique needs and preferences. And they're provided by professional board-certified music therapists. So they'll ensure that you'll receive the highest quality of care. So any questions before we move on here? And again, we'll have time at the end to discuss and ask questions as well. So now we're going to go into a belly breathing exercise. So this is a breathwork exercise and a meditation practice. And this is called belly breathing again. Some of you may have done this before if you've taken my classes. And if you have not, I'll just explain a little bit about what belly breathing is. So belly breathing is a practice where we focus on the abdomen, rising and falling with the in-breath and the out-breath. It's a skill that's particularly effective at calming the nervous system. Belly breathing, it can be used to reflect our mood and also to change our mood. It's both voluntary, involuntary, and under our voluntary control. So when we're going to focus on breathing deeply from the diaphragm, so when we breathe more deeply from our bellies, what we're doing is we're increasing oxygen to the body. We are decreasing our heart rate and our blood pressure, and we're stimulating our immune system. So there's many great reasons to practice belly breathing. And it's a great way to, if you happen to have any trouble with sleep, it's a great way to sort of induce a state of calm and to fall asleep at night. And I'm going to show you how in a moment. And also, if you happen to wake up in the middle of the night, it's a great way to help you fall back to sleep as well. So we're going to begin this practice now. I'll invite you to come into a position that is comfortable. And I'm going to close the slideshow for this practice. So come into a position that would be comfortable for you to do a belly breathing practice right now. And you can do this practice seated. You can do it lying down. You can even do it standing up. So just set yourself up in a way that would be comfortable for you to do a short meditation and breath work practice. And as you come into a posture that's comfortable, the invitation is to gently close the eyes or lower the gaze down to the ground beneath you. Getting relaxed in your seat, and then starting to notice any points of contact that the body is making with the surface beneath you. So bringing the attention down to the feet, noticing your feet, the soles of your feet in touch with the ground beneath you. Noticing the backs of your legs in touch with the support that you're seated on. And coming up to your back, feeling your back in touch with the support of a chair or a cushion, and then coming up to your neck, to your shoulders, coming down to your arms and your hands. And just notice the weight and the position of your arms and your hands. And then coming up once again to your head and your face. And just taking a moment now to get centered and get present into the body seated here. Feeling the full support beneath you as you sit in this moment. And then if you haven't already, come to find your breathing. So notice your breath as it is right now. And we're going to begin here by placing one hand on the chest and then one hand on the belly. So one hand on your chest, one hand on your belly. And then if you haven't already, just start to notice your breath coming in and out of your body at the hand that's on your chest and the hand that's on your belly. So just start to notice your breath going in and out. And not trying to change it in any way, but just becoming aware of the breath coming in and out of the body. And see now if you can identify where do you feel your breath more? Do you feel it in the hand that's on your chest? Or do you feel it in the hand that's on your belly? So just noticing, where do you feel your breath more in the body right now? Do you feel it in the hand that's on your chest? Or in the hand that's on your belly? And now see if you can take your awareness, and as you breathe in, see if you can inflate your belly more than your chest. So breathe in and bring all your breath into your belly. So your belly will expand. And then as you breathe out, the belly contracts. We're bringing all of the breath into the belly here. And so going ahead and placing both hands on the belly now. So we're going, as we breathe in, we're going to inflate the belly like a balloon. And then as we breathe out, we will empty the belly to the spine. So breathing in, expanding the belly, and breathing out, the belly contracts. Breathing in and expanding the belly, and breathing out, the belly contracts. Just allow the breath to go all the way in and all the way out. And so on the in-breath, expand the belly. Feel that belly expand under your hands. And then on the out-breath, the belly contracts. And if you notice the mind wandering at any time during this exercise, just bring it back to the feeling of the belly expanding and contracting on the in-breath and the out-breath. So we've been taught, and just keep breathing in this way, we've been taught that we're supposed to bring our bellies in. We're supposed to suck them in. We're supposed to stand up straight and hold them in. However, when we are doing meditation, we want to have a soft belly, just like a baby. So if you've ever seen a baby breathe, you can notice that their whole belly expands as they breathe in, and it contracts as they breathe out. So we want to have a belly just like a baby. And we were all born breathing in that way. And now, on the next in-breath, see if you can inhale for 3 counts. So breathing in, inhaling and expanding the belly for 3 counts. And then breathing out and contracting the belly for 6 counts. Breathing in, expanding the belly for 3 counts. And breathing out, contracting the belly for 6 counts. So we're essentially doubling our exhale from our inhale. In for 3 and expanding. And out for 6, contracting the belly. And just keep breathing in that way. Breathing in for 3, expanding. And breathing out for 6, contracting. In for 3, expanding. Out for 6, contracting. And you might start to notice thoughts during this meditation, during this breath practice, as thoughts like, am I doing this right? Or this feels awkward or strange or different. And see if you can just notice thoughts as they come by and say, thank you, thought. I get it. And see if you can just let those thoughts go and really bring the awareness back again to in for 3 and out for 6. So here we're using our breath as an anchor. Our minds were made to think, and that's what they do, and that's a wonderful thing. However, for our concentration to increase and for us to be able to calm ourselves, we have to be able to focus where we decide we want to focus. So in this case, we are focusing on the breath at the belly. Breathing in for 3, feeling the expansion of the belly. And breathing out for 6, feeling the belly contract all the way to the spine and empty out. In for 3 and out for 6. So you can picture a ship that might be out on the bay with an anchor. The ship might move from side to side, when it's windy. Just like your mind may have thoughts, running around. But ultimately, the ship stays put because of that anchor. So here you can imagine that your breath is that anchor that brings you back to this present moment over and over, over and over. Anytime the mind wanders, just bring it back to this moment. In for 3 counts, expanding the belly. And then out for 6 counts. And then we'll take one final breath in this way as we come to the end of this practice. Taking one final breath in for 3, out for 6. And then coming to gently drop your hands into your lap once again. And before we open up the eyes, just taking a moment here to reflect on the experience. Taking a moment to check in with the body and the mind and notice how you're feeling. Scanning the body once again from head to toe, just to notice how the body feels and how the mind feels. And then whenever you're ready, we can come to gently open the eyes and just bring some small, gentle movements into the body, wiggling fingers, wiggling toes, taking any stretches you would like with the body, and then gently coming back to the presentation and back to our space together. So I'd like to give you all the option to just reflect on this practice and how it was for you. Would anyone like to share how this experience was? What did you notice about the experience? Share about their experience. Okay, so I'm going to open up the slide deck one more time and um, go into the final slide. And again, the belly breathing is a mind-body therapy that you can use anytime, really. Again, it's used to calm the nervous system. It's used to reflect the mood and can be used to change the mood, as one of the participants just experienced. It truly increases oxygen to the body. It decreases our heart rate and blood pressure, and it actually stimulates the immune system. So it's a great mind-body therapy practice to, to integrate into your daily routine or whatever practices you're already doing. So I'm going to quickly close the workshop, and then we're going to open it up for a Q&A. So I want to leave you with this as our time is almost coming to an end, these few points here. So as humans, we are whole beings, and there's many aspects of our health many aspects of our lives that impact our health and well-being. We can restore our health by becoming aware of and restoring any areas of imbalance in our lives, as you saw in that wheel of health. And there's many tools and practices out there that can support, that we can use as support on our journey to optimal health and well-being. So I want to go into time for a Q&A. If anybody has any further questions about integrative health and well-being, any questions about mind-body therapies or meditation, mindfulness, love to hear from anyone who has any questions.